Hi, I'm Carolyn McClanahan. This is the fourth of my series on healthcare reform, and in this section we are going to cover the American Health Care Act and other things the Republican Party are doing in the healthcare reform realm. The first video I covered the history of healthcare reform. The second video I covered the cost of our healthcare system, and in the third video I covered the Affordable Care Act. So now let's get started. So before I delve into the American Health Care Act, I'd first like to cover what the Republicans want out of healthcare reform. I like to consider it the old GOP versus the new GOP. If you look at video 1, you'll remember Nixon's plan. He had individual mandates, he had subsidies to buy private insurance. That very much is like what the Affordable Care Act did. Now, the new GOP would like a free market system that gets the government entirely out of healthcare. They would like to privatize the entire system. That would be their dream. It'd be very difficult politically, especially with Medicare, but the American Health Care Act was what was starting down that path. So let's go through the American Health Care Act. It didn't pass in March when they originally tried to pass it, and it's because the moderate Republicans thought it was a little bit too stringent, and the Freedom Caucus members thought it wasn't stringent enough in the health care cuts that it made. And so they made more cuts, made the Freedom Caucus happy, and it passed the House in May 2017. So let's go through each provision. The Title I was called Energy and Commerce. Section A was Public Health Programs. It totally eliminates funding for Prevention and Public Health Fund. This is a little scary to me. My training in medicine and especially virology and immunology, I do worry about the next epidemic or bioterrorist event, and we need that public health fund to do that. It gives community health centers $422 million in funding. This is a significant number because that's the exact amount they took away from Planned Parenthood. So it totally stops funding for Planned Parenthood. One of the problems with this is many communities don't have community health centers, but they do have Planned Parenthood, so those communities would lose any access to health care that they were getting through Planned Parenthood. Just as an aside, 97% of the funds Planned Parenthood has is totally for well woman care and for reproductive care. Only 3% is for abortions, and no federal funding is for abortions. So it's going to stop the funding for Planned Parenthood. Section B was called Medicaid Enhancement. It eliminates the essential health benefits for Medicaid. What are essential health benefits? They are the things that are guaranteed benefits within a health insurance plan. So for example, does it cover hospital coverage? Does it cover doctors? Does it cover prescriptions or mental health care? And so if you don't have essential benefits, things that you might have expected to be paid for would not get paid. They are also known as skinny plans. So it provides minimal coverage. There is a very long section in this area of how to deal with lottery winners. And I'm not going to be just on the American Health Care Act. The Affordable Care Act had a very long section on how to protect gun owners' rights. So things get put in there that we don't always understand why, but obviously the Republicans were worried about people winning the lottery and still taking advantage of Medicaid. It also gave states that didn't expand Medicaid extra funding. So this was kind of a reward for fighting Medicaid expansion all those years through the Affordable Care Act. Section C provides block grants to states for Medicaid. So right now there are federal funding formulas about how much states put in and how much the federal government puts in and what that money needs to be used for. So now, if the American Health Care Act is ever passed into real law, these block grants would be given to states to do with as they please for health care. And some states are better about taking care of their constituents than others. And you have to remember that Medicaid cares for both the very poor and the elderly. So where is that funding going to go? And will there be any limits on how much they can give the elderly versus give the poor? We know who votes more, it would be the elderly. So we've got to pay attention to that. Section D, patient relief and health insurance market stability. This, I don't know how this is a relief, but it eliminates what's called the cost sharing for low-income people. Under the Affordable Care Act, people under 250% poverty level, so that's about $30,000 for a single person, got extra help in that they had lower deductibles on insurance. So for example, most people would have deductibles of say $6,000. The lower you were into poverty level, the lower your deductible would be on your health insurance. This cost sharing was given, so the amount of money that the health insurer was giving up by giving people these lower deductibles was paid back to the health insurers through the government. And so this would be eliminated. It also provides a high-risk pool which states must match. So it's $138 billion over 10 years, but states are not required to use that money for their high-risk pool. So you've got to pay attention to whether your politicians really are taking care of the constituents within your state. Let's talk a little bit about high-risk pools. Currently, 2.25 million people have chronic pre-existing conditions. Their average yearly claim back in 2012, that's the latest numbers I could get, was $32,000. We know those average claims are much, much higher now, so that makes these numbers even more significant. So the yearly need of that high-risk pool is $162 billion. That's yearly. And remember, the American Health Care Act was only given $138 billion over 10 years, so not even near enough. And historically, high-risk pools have very long waiting lists, high premiums, caps on coverage, and what we call skinny benefits. So they didn't always cover very much. And the only people that went to high-risk pools were very sick people. So they need a good, robust plan to actually cover their health care needs. Section D, patient relief and health insurance market stability. Health insurers can increase premiums by 30% for 1 year for those not continuously insured. What does that mean? Well, right now, the Affordable Care Act has the individual mandate that says people have to buy an insurance or pay a penalty. And since the Republicans want to repeal the individual mandate, they have to protect the health insurers against people applying for health insurance only when they're sick. So that's why they put this increasing premiums by 30% for people who have not gone with coverage. Starting in 2020, there are limits removed on the percent of premiums that must go for health care. So the Affordable Care Act had a provision that said of all the premium dollars paid to an insurance company, 85% of those premium dollars actually had to go for health benefits. 15% could go for overhead. That was for large group coverage. For small group and individual coverage, 20% could go to overhead. So with the American Health Care Act, the insurance company could take as much as they want as profit or overhead. So they could pay 50% towards your actual health care benefits, and the other 50% can go to pay all their employees, their CEO, and for whatever else they want it to go to that is not health care related. Premium age rating goes from 3-to-1 to 5-to-1. What does that mean? Older people right now through the Affordable Care Act do not pay more than 3 times what younger people pay. So with the American Health Care Act, they will be able to make older people pay 5 times what younger people pay. So health insurance costs would go up significantly for older people who are not yet Medicare age. So that was Title I. Title II is from the Committee on Ways and Means. Section A of Title II is the Repeal and Replace tax policy. It modifies the premium tax credit now and repeals the premium tax credit available to help people pay for their health insurance through the Affordable Care Act after 2019. It repeals the small business premium tax credit after 2019. It repeals the penalty for people not having insurance after 2015. So if this were to pass into law, people who did not have health insurance and they paid a penalty for not having health insurance back in 15 and 16 could amend their returns so they would get that penalty return. It also repeals the penalty for large companies who didn't offer health insurance after 2015. So if a large company, companies with over 100 employees were required by the Affordable Care Act to offer health insurance coverage. If they didn't do this, they had to pay a penalty. Well, if this passes, they could get that penalty back. It delays what's called the Cadillac tax on high-value plans to 2025. So plans that pay for a lot of benefits, and this is common in union-based plans, they're required to pare back their benefits or pay a tax on those higher benefits. And that was supposed to happen in 2019, but it goes back to 2025. Didn't happen yet. So Right now, your health savings account, you can only use for prescription meds, and the Affordable Care Act is what made that happen. That would allow you to use your health savings account for over-the-counter meds, so things like Tylenol, X-Lax, whatever it is over-the-counter that you want, you would have been able to use your HSA to buy those. It reduces the penalty to 10% for money taken out of a health savings account that isn't used for medical expenditures. So for example, if you decide to go buy a car and you use your health savings account for that, the Affordable Care Act makes you pay a penalty of 20%, which is pretty hefty. This would reduce it to 10%. It repeals the limitations on flexible spending account contributions, and it allows health savings account contributions to match the yearly deductible plans plus the max out-of-pocket expenses. So for example, let's say your deductible is $10,000 and your max out-of-pocket is $20,000. The American Health Care Act would have let you put $20,000 a year into your health savings account. That pretty much would just benefit wealthy people because most people don't have that much money to put in their health savings account. So it restores itemized deductions to 7.5%. Right now, the Affordable Care Act only lets people itemize medical deductions above 10%. And for people over 65, it still is 7.5%. The tax bill just floated out by the Republicans in the past couple of days, however, takes away those medical deductions. So it's very interesting how they were going to restore it in the American Health Care Act, but now they're taking it out in the Tax Act. It repeals the 0.9% additional Medicare tax on high earners. So people who make over $250,000 as a couple and $200,000 as a single person would no longer have to pay that tax. It provides a refundable, advanceable tax credit starting in 2020 to purchase individual insurance. So instead of the tax credit you get through the Affordable Care Act, you would get a different type of tax credit. It would be based on age and adjusted gross income. If your credit is higher than your insurance premiums, which is unlikely since we haven't done anything about healthcare costs, that rest of that money can go into your health savings account. So the tax credit amounts are here. You'll see they start very low, $2,000 for people under age 30, and gradually go up to $4,000 for people over age 60. The tax credit is reduced by 10% of any excess income for an individual who makes $75,000 or more, or $150,000 per couple. With the Affordable Care Act, the tax credit's cut off at what's called 400% poverty level. So an individual who made about $45,000 or under would get a tax credit. So people who made over $45,000 would not get any credit. So the credit would be up to $75,000. And realize it's a flat dollar credit, so it's not based on income under that $75,000. Whereas with the Affordable Care Act, the credit was bigger the poorer you are. So if you're very low in poverty level, you got a much bigger credit. You can only count the 5 oldest family members towards this tax credit, and your tax credit can't exceed $14,000. It also repeals some consumer taxes, and these are actually taxes on companies. The Affordable Care Act made the drug companies pay for part of the Affordable Care Act through a fee on branded prescriptions. The American Health Care Act got rid of that fee. There is also a fee on health insurance providers to help pay for the Affordable Care Act. The American Health Care Act would take care of that fee. You would hope that the insurance companies and pharmaceutical companies would pass on those savings to consumers. But, as we saw early in the American Health Care Act, the insurance companies were not going to be limited in how much profit they could make. So we would have to rely on their goodwill to actually pass that on to consumers. The American Health Care Act repeals the dreaded tanning tax, which as a doctor, I'm glad we had a tanning tax because people shouldn't be in tanning booths. And then there's remuneration from certain insurers. I always have problems with that word. It restores the ability of health insurance companies to fully deduct officer compensation above $500,000. What does that mean? The Affordable Care Act put a limit on how much health insurance companies could pay their CEOs and other highly compensated employees. because everything that was paid over $500,000 would not be a deductible expense on taxes, so it's not a good tax deduction. Now, through the American Health Care Act, insurance companies can deduct whatever they pay to their health to their CEOs and their highly compensated employees. So if the CEO made $38 million, the health insurance company could deduct that $38 million from their taxes. Section E repeals the 3.8% net investment income tax, so that tax that people who are high earners have to pay on capital gains. So the Congressional Budget Office did an analysis of this, and they said, based on the American Health Care Act, we would have many more uninsured because of its policy. So in 2018, we'd have 14 million additional uninsured. By 2026, we would have a total of 52 million uninsured compared to the 28 million uninsured they would have anticipated under the Affordable Care Act. So what happens next? Basically, who in the heck knows? The Republicans made a promise to repeal Obamacare. But President Trump made a promise to replace it with something beautiful. That's exactly what he said. You know, and the Senate had to come up with a bill, but they did it in complete secrecy. And the Senate was made up of a group of 13 people, and you can see their pictures here. I think not a very diverse group, that they came up with their health care plan. And actually, the fact that they didn't include women or people of color is probably why it failed. So they came up a lot of iterations, and they finally voted on the Better Care Reconciliation Act. And I loved watching the picture of Senator McCain coming out and looking, and then he gave the big thumbs down. And so right now, the Republicans do not have a health care law that has passed and that has been signed. But because of that, there's a lot of turmoil in the healthcare market, because health insurers, President Trump has said that he's not going to pay the cost-sharing subsidies, and because they have no idea what's going to happen, healthcare insurance premiums have gone through the roof, and we're all hurting. So Senator Murray and Senator Alexander created a bipartisan patch to hopefully help bridge this problem. It would fund cost-sharing subsidies through 2019, so that would give the market some stability, give the insurance companies some stability, so we can have better pricing on current health insurance products. It provides more flexibilities for states to alter their marketplace plans, so it will give states more flexibility to try to help fix the problems on their home turf. It restores funding for outreach for healthcare.gov. You know, the President Trump had cut a lot of the funding for healthcare.gov, and so it would. And the problem with that is nobody knows to sign up for it, which adds more instability to the market. So it restores funding for that outreach. It expands access to what they call copper plans. So right now you have bronze, silver, gold, and platinum plans. People under 30 had access to an even less expensive plan called copper plans that provided some basic benefits and a high deductible plan for things that weren't basic. And so instead of limiting that to people who are just age 30, it was offering it to everybody. And it compels the Center for Medicaid Services to create rules that allow sale of insurance across state lines. The Republicans have wanted to do this for a long time. They think it will bring costs down. That remains to be seen. Most of the studies that have been done across insurance around state lines says that it most likely isn't going to do much, because companies that participate in certain markets know that market, and they're very nervous about going into markets that they haven't had any exposure to and understand well. So, as of my recording of this, it was supported by the Democrats and 12 Republicans in the Senate. But Trump flip-flops on his support of it, and it's only a short-term patch. We're still going to need to figure out what in the heck we're going to do with health care in this country. So that is the American Health Care Act. In the next section, I will discuss what we actually need in health care reform, and that is to fix the system. So stay tuned.